Well, thanks for doing this. Obviously, one of the big concerns now is that vaccine rates for COVID have decreased, and MDHHS has recently put out a statement regarding that. Can you talk about that?
Well, we put out this statement for a couple of different reasons. Number one, there's a lot of misinformation about the COVID vaccine, especially this year, especially in 2025. And I think that what's happening federally has made some of that disinformation and confusion a little bit excessive in 2025. So things have not you have not gone in their usual way with vaccine approvals in 2025. Normally, what happens is that in June or July, there's a group called the ACIP, the Advisory Committee on Immunization Practices, that meets and talks about recommendations for things like COVID and flu vaccine. They give their recommendations. Those are adopted by the CDC, and then everyone sort of proceeds as normal. Now, the ACIP, as you may have heard, was reconfigured. There are some new members on that committee. They did not vote on COVID and flu vaccines yet. The CDC instead changed some of their language around COVID vaccines, and all of that has led to a lot of confusion. And so we want to be just really clear for the people of Michigan, because we had been hearing that there was a lot of confusion, that number one, we have reviewed the data. We've reviewed the data in conjunction with some of our trusted national partners, like the American College of Obstetrics and Gynecology, like the American Academy of Pediatrics, and the data hasn't changed. These vaccines are still extremely safe and very effective at preventing some of those serious complications of COVID-19. And so we want to get ahead of things and just let people know that the Michigan Department of Health and Human Services still recommends vaccines, to COVID-19 vaccine in particular, to everyone ages 6 months and up. So every year there is a new formulation that is based around the strains that are circulating. So all of the COVID vaccines are updated. The two formulations are really dose dependent. So it's not about first vaccine, second vaccine so much as it is about your age. There's a vaccine for adults and there's a vaccine for pediatrics. Now, we recommend that, anyone over the age of 6 months to, in that pediatric age group gets the pediatric dose, and that everyone who is older, including pregnant women, get that adult dose. And usually those vaccines are reformulated and approved by the FDA in the fall. It's a little unclear what's going to happen this fall, but as of right now, there are still COVID vaccines that are available. These are last fall's formulations. They're still available in places like pharmacies, local health departments. They may be available at your local healthcare provider's office. They're still covered by insurance, the major private insurance, as well as things like Medicaid. The Vaccine for Children's program is still up and running, and these vaccines are still both available and covered.
Yeah, and I'm glad you brought up coverage, because that's obviously an important component, given that there's been a change in essentially the federal recommendation. How does that work in terms of a federal recommendation trickling down to insurance coverage, for whether it's for states or for private insurance?
So there's a couple of different sort of pathways here. So number one, there are some federal laws that reference ACIP recommendations. Again, the ACIP has not voted on COVID-19 or flu vaccines this year, for that matter. And so nothing has changed yet. We anticipate that at some point there will be a vote, and we're not sure where that vote is going to land. And so when we look at the federal laws and state laws that reference ACIP, there are requirements for private insurers to cover things that are recommended by ACIP, but that's just the bare minimum. And those private insurers can cover anything additional that they would like to. So, if Blue Cross Blue Shield wants to continue to cover all vaccines, then they can absolutely continue to do that. Now, we are also looking at our programs for kids and for people who are low income. So Medicaid and our Vaccines for Children program, those also reference ACIP coverage. And so if the ACIP recommendations formally change, those programs could be impacted. Now, again, they haven't been impacted yet. So it's a really good time if you are overdue for a vaccine, if you're even thinking about getting your COVID and flu vaccines a little bit earlier this season, maybe in September instead of October, vaccines are still available and they're still covered right now.
How has the vaccine uptake in the state of Michigan been for patients?
Well, we typically start recommending COVID and flu vaccines in the fall. And so our big campaign to remind people that fall's coming, that hasn't really started yet. We're
Mhm.
trying to talk about vaccines a little bit earlier this year because of everything that's happening. But what we have been seeing just over time is that for younger age groups, vaccine uptake has definitely fallen off. If we look at each year from, say, 2020 onwards, fewer people have been getting COVID-19 and flu vaccines every year. The one exception is folks over the age of 65, and their vaccine uptake has increased. And I
Mhm.
think it's because a lot of older folks, number one, they've experienced some things. They have been through really bad flu seasons. They understand how beneficial vaccines are. They may be more worried about their own health. And so we've actually seen for over 65s that vaccine uptake has increased. And I'm hoping that folks out there will listen to and talk to their grandparents, their parents, some of that generation, because that's the generation that may have more experience with things like measles and polio and
Mhm.
pertussis or whooping cough. So folks out there, please listen to your parents and grandparents when they advise you to get vaccinated.
Do you have any specific thoughts or do you have any information on why vaccine rates have dropped off the way they have with regard to COVID in particular?
I think there was just so much disinformation when it came to COVID-19, everything, including vaccines. And that just trickled over onto all vaccines. And you can clearly see the ramifications of that. We're dealing with the negative repercussions right now. So we saw not just COVID-19 vaccine rates drop, not just flu vaccine rates drop, but we saw childhood immunizations drop
Mhm.
after the pandemic. And as those measles vaccination numbers have gone down, the number of measles cases have skyrocketed in this country. And we are now dealing with the worst year for measles that we have seen since 1992.
Yeah. Well, given people's hesitancy or lack of willingness to get vaccinated, can you focus in on some specific groups that really need to get vaccinated with regard to the COVID-19 vaccine?
Number one, I think if you are over the age of 65, if you're in an older age group, if you have heart disease, lung disease, diabetes, if you have any of those types of risk factors, it's really important for you to get vaccinated. But also, if you're in a family where you have a family member who's very vulnerable, it's also a good idea to get vaccinated for them.
Mhm.
And again, we're talking mostly about COVID vaccine today, but it really applies to everything. So if, for example, you have a child who's immunocompromised, who's on chemotherapy or had an organ transplant, making sure that the rest of the family has had all of their vaccines is really important for that individual. And it not only works that way for families, it also works that way for communities. So if we start thinking about how we're benefiting not only ourselves and our own health, but our communities, that's another way to think about vaccination.
Excellent. Well, Dr. Bagdasarian, thanks so much for doing this. I appreciate it.
Thanks for having me on.